All right, it's official. Welcome, everyone. We can get started now. I'm delighted to welcome you to Broaden the Reach, Deepen the Impact, the Center for Innovation and the Small House Movement. So I can't tell you how excited I am that you've chosen to join us here. Please do. I really want to see, I love the networking that sometimes can occur in the chat box. So thank you very much for putting your name and your organization there. You will get a recording of this sometime after the presentation today. Janet, I'll have you stop sharing and then I will start sharing my screen and we will get started. This is really, I'm going to largely just kind of share the journey and kind of where we are, who we are, and why we're doing what we're doing. So as you all know, because you've joined, it is Broaden the Reach, Deepen the Impact, and really exploring the small house movement from CFI's perspective. When we think about who we are and what we do, the Center for Innovation has really been, as their mission, it's to be the catalyst for person-directed living and empowered cultures in the community of one's choice. So you think about person-directedness, and you think about the empowered cultures, and you think about the two signature organizations that make up Center for Innovation, the Greenhouse Project and Pioneer Network. And those two organizations coming together has at the core of who they are, what they do, is to create those person-directed living and empowered cultures, and really thinking more broadly along the continuum. When I think back to the Greenhouse Project and the 20-plus year history since that radical innovation hit Tupelo, Mississippi, of all places, and created a deinstitutionalized model, and everybody who's on the call, I've seen some of the names in there, you know what it is. But I'll tell you, the innovation is just part of the DNA of that greenhouse model. I think about since its inception, the trademark model has enabled research to be done, and not just on one location, but research really literally around the country. It has garnered a reputation, certainly with the COVID data. We literally were heard around the world with some of the research and the media coverage of what had happened in those greenhouse homes. So that network of homes, the education and training that has informed what we do, the tools, the resources, the coaching that has been a part of it. That's the innovation, the DNA that is a part of Greenhouse as it pertains to a small house movement. But in addition to that, I think what has been interesting, we partner with thought leaders, we partner with innovators, and we have partnered with those that where Greenhouse initially was thought to be, it's for long stay. If you're needing rehab, you've got a place to stay. So this is where it has gotten very interesting, is that we've had providers that have said, well, actually, we'd like to incorporate rehab into the homes that we will bring to our community. We have greenhouse homes that are supporting individuals living with disabilities. We have a couple greenhouse homes that PACE participants are living in greenhouse homes and going to the PACE site during the day. We have about 20% of greenhouse homes are supporting a licensure of assisted living. I have memory care as a separate bullet, but I can tell you our research has shown us that we have over 80% of those that are living in greenhouse homes are living with cognitive, from mild to significant cognitive impairment. And we do embrace a very inclusive, integrated, our homes are for people with, without, that we live together, and adult family care. So when you think about our expansion, we've already partnered with people that are saying we can do more. And in fact, over the 20 years, we have done more. It was in 2023 that 8 greenhouse homes opened in Adelaide, South Australia. And that was the first time that the greenhouse model took that innovation to a different country. And it was very exciting that greenhouse trademark opened in Adelaide, Australia in 23. The end of 2024, greenhouse trademarked homes opened in Toronto, or outside, actually Hamilton, Canada. And so we now have registered greenhouse trademarked homes outside of the US. So I think for me, what has been exciting as I think about this model, it's not been a static model. Yes, the small house is amazing. That what happened in Tupelo 20 plus years ago is amazing. But we started thinking to unleash innovation. We asked what if to take us to what's next. So the what if. And so we started thinking about the trademark, which many have said it's so prescriptive, it's very rigid. That rigidity or prescriptiveness has allowed us to be able to study those quality standards, those elements. And the research has given us, we have data that has really been very helpful. But we started asking, what if we adapt those quality standards? And what if we think about some of the unique opportunities that might be out there? We often would have folks come to us and they would say, we'd love to do greenhouse, but we've got this many beds to take from a traditional building, and we want to put them in homes on this size lot. And so could we perhaps have more rooms per home than the trademark would allow? So what we've done is to develop a process by which we take a look at the quality standards, and organizations that want to request a waiver, they go through the process and let us know these are the waiver requests that they would like to do. This is all done with the idea that we are going to go through that process, and we have a subcommittee of the Center for Innovation Board that reviews the request, and they really want to make sure that that request is designed to meet the intent of the quality standard. We're not trying to dilute the greenhouse model and the integrity and what it really means. We believe that what was put together, this innovation by Dr. Bill Thomas, that we believe it's important, and we've studied it, and we have data that tells us it's important and it has made impact. But what if, what happens, and how do we really go down and they can achieve the greenhouse trademark within reason? And then as we think about the future, and recognizing the future is now, everybody's talking about the demographic shift with the baby boomers aging in, and everybody's saying which direction, where should we go with the future? And certainly at a time such as this, I would say our future is now, that we've got to be thinking differently now, that we've got to be thinking boldly now, courageously now, and we have to identify where are we able to find those models that are going to improve quality. We've got to take a look at the costs. What are the associated costs? I think it's all about taking a look at how do we gain efficiencies that will continue to generate the commensurate quality that is so important to us. And how do we ensure that what we're creating is really meeting consumer demand? I also say it's about accessibility, it's about affordability. We're not trying to create something that is just for those that have the wherewithal to pay privately. We want to make sure that it fits within government systems. We want to demonstrate that there is opportunity to go small and achieve big results. And so we are embarking on the small house model, and the models being plural. That yes, I've talked all about the trademark waiver, and really wholeheartedly expressing our support for the greenhouse model and what we have done over the 20 plus years. But it's time to study small house models plural. And so we are embarking on a campaign to take a look at existing models that have already been built, to really coalesce a network of small house homes. I'm working with a data company that will be able to then put our data together and create a survey, a tool that we will be able to study different models so that we can study variability within small house models. Once again, to identify what is generating the quality, what are the associated costs of care, and is it a place where consumers want to be and can afford to be, that they have access. So this was not intended, our webinar today, to be kind of we're telling you everything about what's happening right now. What I will tell you is that if you're interested, there are two opportunities for you to learn more. One will be at a workshop June 3 and 4 in Mirasol. That's Loveland, Colorado. Loveland in June is a beautiful place to be. And they've got 9 greenhouse homes there. I'm very excited for you to see those greenhouse homes. 9 homes, there are 10 elder rooms within each of those homes there. So you will be able to hear our speaker, I will introduce in just a moment today, Jeff Finus, who is the Executive Director of the Loveland Housing Authority. He's going to tell you their story, so you get to know a little bit about the history of these homes. In addition, John Ponte, who is the owner-operator of Southern Administrative Services, he will be there. He happens to be the managing partner of the homes here at Mirasol. And John will tell his story about really talking about a management company and how to really think about how to choose a management company and what should you be thinking about. He'll also share some of his experience as a provider who has used the greenhouse trademark waiver in one of his newer communities. We'll have market feasibility. Michael Starkey with PMD will be there to talk about market feasibility and bringing your homes to fruition. We have Rob Simonetti with La Bella Architecture. He's an architect and can talk about those design principles that really matter. John Franklin, Pearl Creek Advisors, he's going to talk about the strategy and financing for such a project. I will be there along with my colleagues, Zoe Garza and Rachel Graham, and really eager to continue CFI and the small house movement and thinking about the future of small house elder care design. Our small house summit, the CFI conference, we'll talk more about that at the end, but we're having a post-conference session, the small house summit, in which you'll be able to see 3 different communities. One is a household renovation to traditional buildings. So that was renovation in an existing building to create households. And you'll be able to see 2 small house communities. One is a greenhouse community, and one is a small house community, all in St. Louis. So come to our summit and you'll learn more about what we are aiming to do. So that's really all I'm going to say. I'm going to turn it over to Jeff Finus, and I'm going to just read a bit of Jeff's bio. I got to know Jeff several years ago when I was working with the greenhouse homes in Colorado. Jeff has worked for the Loveland Housing Authority since 2007. Prior to that, he held the position of project manager and housing manager, director of real estate development. Jeff's tenure on the Loveland Housing Authority has created more than 500 new affordable housing units in Loveland and the surrounding communities, created 47 single-family home lots for Habitat for Humanity, and of course has been an integral part of the 90-person, 9 houses, that's 10 elders in each home, the greenhouse homes at Mirasol. So I am really delighted, Jeff, that you are here and you're going to share a bit about the story of the Loveland Housing Authority and how those greenhouse homes came to be, and a little bit about your experience along the way. So with that, I will turn it over to you and remind everybody that at the end of Jeff's presentation, we will save some time for questions. So if you've got questions, please put them in the Q&A box. And I will take a look at this. Actually, it looks like there is there's a Q&A box. So put it in the Q&A box, and I'll take those questions at the end. So Jeff, over to you.
All right, thank you, Susan. So I would like to reiterate Susan's invitation to visit us at the Mirasol campus in Colorado, June 3rd and 4th. Of course, I'm a little biased, but it's a beautiful campus that includes affordable housing and, of course, our now 90-bed greenhouse homes. And we always like to show off a little bit, but I do believe it's an excellent example of why the small home model is working and how it can blend into an existing community. But with that, I'm not going to give away everything because we'll be having a longer version of this discussion in June when you all are out there. But I need to start with a little explanation of the Loveland Housing Authority and how we ended up in the world of skilled nursing. And in short, as you gathered from my bio, our core business will always be the development and management of affordable housing. And a large portion of our portfolio is dedicated to seniors. And what I've come to realize is that is really the first step in providing good healthcare. If you can keep people in an affordable, safe home, that's a great start. But the reason that we built greenhouse homes and ventured into the world of skilled nursing really started with the needs of our own residents on the campus. We have roughly 225 units total. Uh, we started to hear questions like, well, what happens when my spouse needs care? Where do they go? And I would like to be able to walk to go visit them. Uh, as usual, we're mission driven and we respond to community needs. And about the same time, we were beginning to hear from city council and citizens, uh, housing authority. Is there something you can do? Um, we also had a personal connection. My predecessor, Sam Betters, at the time was trying to find adequate care for his parents, was struggling. But most important, the reason we did it is as simple as this. It's the right thing to do. As a community, whether it's local or national, we have an obligation to do better in the skilled nursing arena and treat people with dignity. And there's nothing better than the small home model to do that. What we ended up developing, as Susan said, at first it was a series of 6 10-bedroom homes, so 60 beds total. Very significant is that they were all Medicaid approved. Uh, we clearly have that need in the community, but also that's in keeping with our mission of providing affordable housing. We were able to extend that into skilled nursing. Based on the success of those homes, we were later able to build 3 more. We were able to acquire the land next door to us, and we now have 90 beds total and still 100% Medicaid approved. We do accept private pay as well. As you all know, there's good financial reasons to do that. But as Susan said, this housing or this service needs to be available to everybody, regardless of economic status. How we built it, stepping out of our comfort zone, we learned about new market tax credits and a new world for us, but we were able to fund those first 60. And by statute with that program, at year 7, we knew we were going to have to refinance the entire campus, which we did. But based on the success of the first 60, we decided to expand and add those second 3 or the set of 3 new homes. And those were financed traditionally, no tax credits involved with that. Unfortunately for us, we thought we were doing great. We broke ground before the pandemic. We completed construction during the pandemic, which the timing worked out that we did not realize some of the construction cost increases that others were seeing. And about the time we thought we were really smart, we discovered we couldn't open the last 3 because we couldn't staff them for all the reasons that you all know, the staffing difficulties at that time. Susan mentioned in her presentation that this is not a static model. And over the last 5 years, we have certainly come to understand that a whole lot better in the operations sense. What we learned is that we're only as good as our management company partner that we're working with. And we had two prior partners to the one we have now, which happens to be John Ponte. And the two partners we had were absolutely best in the state, good partners for us. But we discovered that we needed to make a change and really focus on this model. This model is unique. This model is special. It needs to be run different and cannot be operated like a traditional facility. And we've now found that right partner in Southern Administrative Services, John Ponte and his team. And what that has done is really allowed our campus to not only survive, which is what we were doing, we are now thriving again and looking at, what does the future hold? We have different opportunities now. Maybe there's an expansion in the future. And really, it's the result of being willing and able to adapt, make required changes, but always keeping an eye on the purpose that we did this in the first place, which is providing that first class healthcare service to the elders that need it. And as I said, to wrap things up, I'll have a full presentation in June that I'm looking forward to presenting. We'll go into much more detail into all of this, what it looked like for the Loveland Housing Authority and in our campus. And with the greenhouses right across the street from the event center, of course, we'll be giving tours as well. So I hope you all can make it. But until then, I'm happy to answer any questions you might have now.
Well, thank you, Jeff. That was really helpful to kind of set the context a bit and talk a little bit about your experience with the homes there. So I would love to invite people. I don't see any questions in the chat yet, but if there are questions, I'd love to have you voice them right now. As Jeff said, we are really excited to welcome you to Loveland. I think it'll be a real opportunity. As I always say, seeing is believing, and to really sit down together and really unpack the story that really has brought those homes to fruition and has really kept them viable and really, as we say, just continuing to bring quality of life to those that live there. So just wondering if there are any questions from anybody. Don't see anything. Here's one. What were obstacles from your two prior management companies? Talk a little bit about what some of those obstacles are. Let's start with the first one. What were the challenges that it didn't work so well? And as you said, both, this is not to cast any disparagement on either, except to say there were some obstacles. These are wonderful organizations. But what was it exactly that made it so challenging?
Absolutely. And I have to reiterate what Susan just said. No disparaging comments about our past partners. They did us well. It just came time to make a change, which I'll get to here. So our first partner was with us really through the conceptual stage is when we met them. And they hung in there with us through the good years, the great years, which were pre-COVID. In the COVID pandemic, things got difficult for everybody, and our partner was struggling not just with our campus, but with their entire portfolio. We've got a large number of their own communities across the state, and it just became more difficult. Of course, Medicaid rates were in flux at the time, and never enough. The finances became more difficult. And it just, we came to a mutual understanding that it was just time to make a change so we both could work on our respective businesses. And we changed to a second operator that is very good at what they do, very good. And again, one of the best or the best in the state, but not much experience with the greenhouse or small home model. And some things just have to be different. We understood that going into this new partnership that there would be a transition. Unfortunately, we were running in the red some, which did not make the bank happy. Um, and that added a lot of stress to the situation. I'll just leave it at that. But that partner just did not have enough time that it was going to take to educate themselves and to make necessary changes in our operations. And with I'll just say the support, if you will, of the bank, we had to make one more change, and we had the opportunity to work with John Ponte, who is without a doubt the best small home operator in the country and has the scale to lend a whole lot of resources into just looking at operations and making the right changes and trimming costs. And what I've learned from that is you just need the right partner with the right skills. Unfortunately for us, until the industry became very difficult at COVID, it was easy to see, or maybe we didn't have the best partner, but they were adequate for sure to get the job done. But when it got difficult, we needed that specific expertise. In a willingness to learn it and share it is probably key. But I'm happy to report, and Susan, I owed you a phone call, but I already shared the dirt that we're operating in the red, and I'm happy to report that March financials are out, and we have turned the corner, and we are profitable again for the first time
That,
in quite a while. So
that
I'm
is
claiming
just great.
success,
I love
all on the
it.
back of John Ponte and his remarkable team.
So, yeah, I'm looking at a question. It says, you mentioned you're thriving with Southern Administrative Services, John's company. Explain what it looks like to you now. Obviously, operating in the black would be one of those things. And I think another related question to that, so I don't know if there's more you want to add to that, but give specific examples of how management needs to be different. And can operators, I mean, you mentioned that the previous company, that was your management company, they didn't take time to learn the greenhouse per se. So do you believe that operators can be taught how to run a greenhouse home? And if so, how can they learn those skills? So talk a little bit about, it's kind of a combo question.
Sure, I'll try to remember all that to get to it. So let me start from the back and say absolutely. I think if an operator is willing, anybody can learn. It's not rocket science. And one example is that we were simply spending way too much on dining costs, and it's easy for costs to get high when you've got a higher staff to resident ratio than traditional. But there's also ways to minimize that. And with the dining cost, John came in, looked, instead of having an expensive model that required two expensive resources, we can now do it with one and leverage the dining areas. And on the construction, I just have to throw in a plug for John here. His latest designs are pretty innovative, where one kitchen serves two homes, and the homes are connected at the kitchen, and it's genius for all the obvious reasons. But also, what I'm about to say would probably be true in any facility, but getting away from temporary staff and just having our own staff, not only which we have had no temporary staff since February 15th. And that obviously results in cost savings, but it also greatly improves operational efficiencies because you're not always retraining staff. And as you all know better than I do, dedicated staff are more invested in the mission and in providing services, know each other, know the residents, and it just much more efficient. And then also things like, nobody wants to talk about trash, but for us, a big expense was picking up trash at every home. And we found ways to centralize that and still keep within the model. Um, we don't want trash cans out front. It saved a lot of money. So I guess what I would say is there wasn't one big bullet, so to speak, that solved the problem. It was a lot of diligence in every corner of the operation. And of course, finding the right staff.
So here's a couple other. First of all, there's a question: did the state provide any incentives or regulatory breaks to develop or operate your homes?
No. But I will say, and I should have said this in my first presentation, is that when we were awarded that initial Medicaid award, those were the first new Medicaid beds in Larimer County in 50 years because of the lack of funding. And the reason that we were awarded those is that we demonstrated innovation in quality of life with the small home model. And so I would say from the very beginning, we had that incentive. And had we not been Medicaid approved, we would not have built.
Right. Do you happen to know what your payer mix is? What percentage Medicaid versus private
Well,
versus?
it's changing in something else with SAS on the revenue side. They are changing the payer mix. When they took over, we were close to 90%, maybe even a little bit higher Medicaid. And we are now starting to see more private pay. I don't know the exact count, but I would say we're out of the 90 beds, probably about 20 of them are private pay now. And what we're working towards is getting back to about a 40-60 split, 60% Medicaid. That's what we had agreed to up front.
So do you do any Medicare at all?
Yes.
You do. Okay.
Yep. Something we introduced before SAS came on board. But we've got a rehab home with a gym and another philosophy from, sounds like I should be on John's marketing team, but a different perspective that he brought is that rehab home is critical, not for the short term, but the long term. Inevitably, somebody that has spent some time in that home, hopefully recovered and moved on, they or somebody they know is going to need skilled nursing. And if they had a great experience in the greenhouses, we're going to be their first choice to come back.
So this looks like our final question, but can you share what you believe makes the greenhouse model work? And as you've kind of sat there since the beginning, and here you are now, now you're on your third management company. What makes it work from your perspective?
I'm going to answer two ways. So the first one I'm going to answer is how does the business work? And it's all the things I touched on, really paying attention to the details, being diligent, being aware, and staff needs to be aware of how they affect costs, and revenue as well. And so you have to run a good business. The small homes are not going to run themselves and be successful just because it's a great model. And you just have to run financially more diligently than that. But the other reason or other definition of run well that I just need to talk about is the quality of life. And I'm going to try not to get too emotional, but my own family member, my own mother-in-law ended up uh, living in the greenhouses for 5 years.
Wow.
And she, when she went in, she'd been in a different facility and didn't go so well. And honestly, when she moved in, everybody thought, well, this is a nicer end of life. She'll have 2 or 3 months. And lo and behold, she started to thrive. And it's that environment, the socialization, the having autonomy over her life. And for her, it was all about food and the ability to go cook an omelet if she wanted to make herself an omelet, or well, sleeping too. She loved to not get up till 11 o'clock. And so that quality of life, I think, is the ultimate success and is why I said it earlier, as a community, large or small, we need to treat our elders better. And this model does that. It provides dignity, autonomy, and happiness and contentment. And I saw it personally, but I also see it in the other residents. It's just the right thing to do.
Yeah, absolutely. I saw another question, I believe. Are there any greenhouse homes operating in California? The answer is yes. If not, what red tape should California be prepared for in order to adopt this model? There's actually a small house skilled nursing home pilot in the state of California. And they have created regulations to support the small house model. They really developed those regulations after the greenhouse model. Um, Not that it's a trademark greenhouse model at all. So there is a pilot program, and you can reach out to us aside, and I can certainly help you if you've got interested in developing something in California. One more question, it looks like I just saw. Are the utilities like HVAC independent for each building or home, or were there any consolidation to reduce energy usage?
So I can only speak to the city of Loveland, but I assume it would be similar across the country. Uh, we it took a little work, but we convinced the city to look at these not as a facility, but as single family homes that happen to have 10 beds. And the reason we needed that is things like trash, services, the look and feel of the neighborhood that we wanted. Um, it made it a lot easier with that. The downside to that is that they are all individually metered for all of the utilities. Now, having said that, we were working on another potential project that did not come to fruition with Dr. Bill Thomas, and it was going to be clustered small homes. And the city had changed their mind, and they were willing to let us master meter that neighborhood. My argument was, what's the difference if you have 60 clustered homes or 60 apartments under one roof? It should just be one, and they agreed. So at least in Loveland, that was the situation then. I think they've changed their tune a little bit, and they might be willing to master meter, but our homes are all individually metered.
All right, one more. Will you be building any more homes? If so, would you consider 12 beds or keep it at 10?
Very informed question. And now that I work with John Ponte, absolutely it would be 12. And in fact, we are starting the scope of renovation project in that we're going to add likely 2 bedrooms to each of our existing homes, because John's helped me understand that 12 is the sweet spot, expense versus staff to resident ratios. And we're landlocked now. So at the moment, it's difficult to say if we would build more buildings. Certainly, if we had the opportunity, we would consider that. And we have had those conversations with John. Probably a little too early to say for sure. We have to find the land contiguous to our campus.
Well, it sounds like the need is there, for sure, to build more homes, and certainly adding the 2 beds. You know, it's interesting. Jill Wilson, who's the CEO of Otterbein in Ohio, she started with 10-room homes and has recently added 2 additional rooms to each of her homes as well, believing that, you know, the economies of scale and such, that she believes that it actually does work a bit better. So I do think that what you're saying is seemingly becoming true for others as well. What about remote patient monitoring devices that complement any virtual care models? Do you have any such thing?
We do not, and I have to admit now I've hit my limit of my knowledge on the actual operations of a skilled nursing facility. So
Well, which is
but
why
I'll have John with me.
exactly. It's the phone a friend, and I think, you know, really more importantly, it's I remember Sam Betters used to always say we're housers. You know, healthcare, that's not our wheelhouse, and it was important to partner. And, you know, but finding the right partner is,
Right.
and your experience has certainly shown, you know, that there are good providers out there, but finding somebody that can really understand, know, embrace, learn the model, and really work to ensure that it continues its sustainability. So, Janet, I am going to have you um, share our slides, and we're going to conclude today's webinar. And there you go. So if you haven't heard us say it yet, hear us say it again. We really hope you'll join us in Loveland, Colorado. I'm really excited to go west and to really just kind of bring the best of John Ponte's knowledge as the largest owner operator of greenhouse homes, I guess, in the world. But he's going to talk about it from a management perspective. He can certainly talk a bit about and Jeff alluded to it, the greenhouse trademark waiver that he has done in Texarkana, Arkansas. That's June 3 and 4 in Loveland, Colorado. And on the next slide, and Janet is putting links in the chat. So if you'd like to take this opportunity to register, please feel free to do so. I'm excited to really have Marla and Mary, our education powerhouse. They're going to talk a little bit about our approach to learning. And it's more than a model. And I'm sure, Jeff, you would attest to the fact it's not just about building it and voila, it works, but it really is about that learning opportunity and the growth opportunities to really embrace more than a model, but that whole philosophical approach and the role that our education and training does to really support you as you go forward. Next slide, please. There you go. And our conference is coming in St. Louis, Missouri, August 11 to 14. We are in St. Louis for many good reasons. You can go to our website to learn more about the conference. We've got an amazing lineup of speakers and sessions and things that you just aren't going to want to miss. It's that power of networking. I've already alluded to the Small House Summit. That's a post-conference event. That's on the 14th. So you'll want to come early, stay late. So you'll be able to really kind of bookend your visit around 2 packed full days of conference. Next slide. Elevate Elder Care podcast. I think it's probably one of the most exciting things that I do. I talk to some of the most brilliant people to really unpack kind of what their perspective is and how, they see what we can do to elevate elder care. I believe that's it. So with that, I want to thank everybody for coming today. And I really, really, truly appreciate your time, your interest, and elevating elder care and really advancing the small care home model. And we look forward to seeing you at one of our webinars or at the workshop in Colorado. So with that, goodbye, everyone. Thank you, Jeff, for joining us today and for sharing your perspective. And thanks again to all of you who joined us. Take care, all. Bye-bye.